Welcome back to the Voice of Oceanside. Joining Larry and myself is Donald Dawkins, Vice President of Strategic Integrations at Tri-City Medical Center. Welcome to the Voice of Oceanside, Donald.
John, thank you for having me.
I look forward to talking to you, and your discussion is a serious one. I mean, every 30 seconds, a person in the United States has a heart attack. It's a scary statistic, but one that we have to internalize and understand. Can you take us through the symptoms of a heart attack?
Yes, I can, John. But first, let me just share with you that cardiovascular disease, it's a global problem. And clearly, in America, cardiovascular disease has a significant impact on our population. The symptoms of cardiovascular disease generally result in discomfort around the chest or the thoracic area of the body. The discomfort generally results in pain. And then that pain is also associated in other areas. There's also discomfort associated with pain radiating through the shoulders, oftentimes in the jaw, and sometimes in the neck.
Now, is the old wives' tale of which side? Is that an issue?
No, it is not, absolutely. In fact, other symptoms of cardiovascular disease doesn't choose a side. You know, used to hear back in the old days of cardiovascular health that the pain was, the left side of the shoulder radiating down. But now it's bilateral. It can affect the left side, the right side. It can affect the neck. And we have other symptoms of cardiovascular disease or heart attack symptoms that are very unusual, because what we're seeing in healthcare as it relates to cardiac and health and heart conditions is that women present sometimes with different symptoms than men do. And so you may have a discomfort in the stomach, nausea is often associated with heart disease and or having a heart attack, and also weakness, the general end of the day kind of unusual fatigue. Yesterday I felt fine, but today I just don't have the energy. So that's also associated, general fatigue, nausea. And because cardiovascular disease is a disease of the circulation, the blood flow in the heart and the oxygen that's distributed to the various vessels and the various organs of the heart, there's a tendency for patients to be short of breath. So you have a difficult time breathing. Those four key symptoms, the discomfort generally in the chest, the pain radiating across the different parts of the body, possibly nausea and or general weakness, and that shortness of breath are the key symptoms to look for with heart disease or heart attacks.
Let's make this even a step clearer. Should people be waiting until they have all four? Should they move on one? Should it be two of the four? And I say move as in get professional care.
Whenever you have a symptom, whenever you have any of these symptoms, any symptom that is unusual, you need to kind of queue up. In a previous segment, I believe Mr. Raymond talked about pain, and pain is an indicator of something is wrong with your joint. It's very similar with the heart. When you have chest pain that you do not normally have, that's an indicator that something is wrong. Now, if it's if you've eaten a bad meal and that stomach indigestion, don't ignore it if you're not one who normally has stomach indigestion. If you have chest pain and that's not normal for you, don't ignore that, because what could be happening is that in the vessel of the heart, as the blood goes through, could be narrowing, and slowly you're starting to feel that discomfort, and all of a sudden it manifests itself one day because maybe you had either a stressful event or you've had an additional amount of workload because you exercised harder. So it's important that these symptoms are absolutely not ignored.
Now, something else you're not saying that I want to sort of put in the urban legend category. I notice you're carefully not going into the detail on what the pain feels like, these descriptors, and people try and play that game. Well, I have pain, but it's not a sharp pain, therefore it's not a heart attack, it's indigestion.
Yes, and the reason why I didn't want to go into that, because the classic symptoms that you would hear about was, I have a crushing chest pain. Well, that's usually for those heart attacks that are very, very aggressive. A sudden kind of heart attack results usually in a crushing kind of pain because you have a quick and immediate stoppage of blood to that artery, from that artery, and the muscle in the heart starts to die, so that pain generally occurs. But in the average person, the average person who's having a heart attack, and by the way, there's a lot of people having heart attacks. We have over 600,000 heart attacks per year in this country. So the average person having a heart attack may have unusual symptoms, the milder uncomfortable pain. It's just, I just don't feel good. I feel this chest, but I'll sleep it off. I'll wait till tomorrow. And all along, the muscle of the heart is dying. And it's critical that intervention takes place very early. One of the staggering statistics, and it really is one that causes us to wake up and realize how important it is to treat heart disease, is that for every minute that a person waits when they're having a cardiac arrest, it increases their chance of dying by 10%. So that's why it's so important that when you start to identify these symptoms, you come to the hospital and get treated early. Our emergency physicians will tell you that it is better for you to come and us evaluate you and determine that you're not having a heart attack and send you home versus staying home and suffering from this very, 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 very painful and very, very difficult type of symptom.
One more and then I promise we'll move on.
Okay.
I think people who live through the pain assume that if they lived through it and didn't collapse, they didn't have a heart attack. Is it possible to live through one and not know it?
Absolutely. Those are often, the term that's often used is called a silent heart attack. A very minor amount because the obstruction may be in a smaller artery versus one of the larger arteries of the heart. And so a person would go on not realizing that they've had a heart attack, and so would move on through their day and not realize it. But what we're finding out is that because of the impact of heart attacks, again, over 600,000 to 700,000 heart attacks per year, 50% of those individuals have a recurring or a second heart attack within the same year. So it's very important that these minor symptoms, although the impact may not disturb your activities of daily living, they should still be evaluated. Go in to the emergency room or immediately see your cardiologist, because when you're having these symptoms, it is so critical that you call 911. Do not drive yourself in to the hospital. Because by responding with 911, you have the emergency team who can start treating you on the way. You can have early notification to the hospital that you are coming, which allows the hospital to trigger the specialists necessary to care for you. The doctors, the staff would be caring for you in the catheter labs and the procedural areas.
Wow. Let's talk about the services that you offer in the cardiovascular area at Tri-City.
Well, when we use the term cardiovascular, John, cardiovascular is we're looking at heart disease and vascular disease. So we're looking at disease of the entire circulation system, every place where blood goes that has to do with cardiovascular disease. And the specialists that provide this care are both cardiologists, interventional radiologists, vascular surgeons, and cardiothoracic surgeons. And in that area, you're looking at specialists who have the capacity to treat all of the different symptoms. Coronary heart disease, which is the bulk of the services that are provided, deal with disease around the heart. But there's also peripheral diseases and the vasculature of the legs. So it's important that we realize that. The services that we have are absolutely incredible. I'm very proud to be a part of Tri-City Medical Center because coming from a university environment, I recognize that in our community, the services are par none. That we have the state-of-the-art interventional suites. We have 5 interventional suites. And for a community hospital, that is very, very significant.
And an interventional suite is? And
an interventional suite is actually where the physicians and the technicians and the trained nurses are performing these procedures. One of the things that is very unique is when you have a heart attack, it is a very difficult thing. You can imagine the impact on the family, and I'm sure that there's probably no one we know who have not had either a family member or friend, a coworker who've had a terrible impact from this disease. And so when you're being treated in these interventional or these cath labs that we call them, these are the rooms in which the procedures are done. And oftentimes, one would think of it as an operative room environment, and it is a very sterile environment. But while you're going through the procedure, you're awake, you're having a conversation with your doctor, and although you may have come in with that pain that we discussed earlier, while they're intervening on you, while they're making that difference, while they're opening up those arteries or dilating those vessels, you can actually feel that pain or that pressure, just relief. And oftentimes the patients are saying, wow, I feel better. And that conversation is occurring between the staff who's providing the care and the physicians who are opening up those arteries.
Now you've got some accreditations and certifications that are involved in this as well.
Yes, I know Mr. Anderson mentioned some of those certifications earlier. Yes, we are a heart attack receiving center in San Diego County, and that's a very unique designation. There are only 13 facilities in San Diego that out of the 22 hospitals that are actually heart attack receiving centers. And in our North County area, Tri-City Medical Center is one of those heart attack receiving centers. The unique thing about being a heart attack receiving center is that when we have to meet certain criteria, certain national benchmarks, we have to make sure, remember I said before, that time is a critical element to the outcome.
Oh, I remember that.
Okay.
I remember if I wait 10 minutes, I'm dead. So it's 10% a minute. That's how I'm going to remember.
All right, that's good. That's excellent, John. But what we're saying is that time is muscle. And so you want a center that has met all the national benchmarks and the guidelines of best practice to be available for you. So you want to get to the closest facility. And so our STEMI Receiving Center is a way to be acknowledged as a facility that has met all of the national guidelines, the time requirement guidelines. For example, we need to have a person treated for a heart attack within less than 90 minutes. STEMI receiving centers need to meet that benchmark, and we at Tri-City Medical Center, not only do we reach that, we exceed it significantly. Our average door-to-balloon time, which is a term that's used from the time you arrive at the hospital's front door till the time we're able to opening up that artery and remove that blood clot or whatever is causing that heart attack, our average time is about 68 minutes, and we've had times as low as 30 minutes. So we are very proud of the technology that we have to treat and intervene on patients.
Now, technology, I assume, huge part of this, just like it was with our earlier discussion in orthopedics. You've got a new cardiac catheterization lab. You've got intravascular ultrasound. Do you want to address those for a minute?
Yes, intravascular ultrasound or technology in the cardiovascular space is tremendous. Intravascular ultrasound allows the physicians to look inside of the artery. So instead of just looking at X-ray images, as in an angiography, you're looking inside the vessel. So the physicians can look inside to see how and what closure devices need to be used, how dilated the vessel should be, how much blood flow is actually going through the vessel. That's one way. There's another technology that you don't hear much about. It's called an angiojet. It's almost like a vacuum cleaner that goes into the heart and sucks out the clots so that that blood flow can be reestablished. So the technology is just incredible. One other comment on that is that we have what's called a PAC system, which allows our physicians, if they're in their offices, to be able to get online on their computer and see the very images of what's occurred to a patient that had these procedures in the operating suites.
Excellent. Now, all that's going on now, and in April, you have a new cardiovascular institute coming.
Yes, we are very excited about the Cardiovascular Institute coming. And Larry, would you want to speak to that a little bit?
Well, Donald is actually, his functional area is heading up the development of all of our institutes. But the first one we'll launch is the Cardiovascular Institute. As you say, John, that's going to be launched in April. And we will bring all of our cardiovascular services to bear to do diagnostic work with the individual. And all of our physicians are participating. In fact, it's a co-investment model between the hospital and the surgeons who practice in that area. And quickly following on the Cardiovascular Institute, we'll launch an Orthopedic Institute, which will include the Spinal Institute I mentioned earlier, and then on through neurosurgery and so on. But this is a co-management model that's designed to improve the processes and the outcomes. When you have a cardiovascular problem or an orthopedic problem, the most important thing to you is what's the outcome? What is the history of that hospital in terms of the outcomes they provide for that particular area? And that's exactly what these institutes are designed to improve.
A lot happening in each one of your service lines. I have a feeling
Yes.
we could expand the show and cover every one of them and do 10 minutes, but we're at our next break, believe it or not. In our next segment, we'll talk to an emergency medicine physician, an internal medicine specialist from Tri-City Medical Center. But first, let's take a look at a short segment about a Marine Corps major who recently utilized both of these services. I think you'll find this both interesting and moving. We will see you back after this short clip.
I would run for a few yards and then have to stop because I had was out of breath.
After serving 13 months in Iraq without incident, Major Chris Gillette was relieved to be back at Camp Pendleton, out of harm's way. Or so he thought.
As I got about halfway across the street, the lights literally started going out, and I knew, without a doubt, I was in serious distress at that point. And my only thought was I had to get into that clinic. I just, if it took everything I had to get in there. I literally fell through the doors of the clinic.
With no vital signs for 2 minutes, it looked like Chris was having a stroke or a heart attack. The Naval Hospital on base isn't equipped to handle such extreme cases, so they rushed him to Tri-City Medical Center, a Joint Commission-designated primary stroke center. Dr. Stephen Karras has been an emergency room physician at Tri-City for nearly 4 decades, and every bit of that experience worked in Chris's favor.
I knew it pretty much from the beginning because we went right away to the CT angiogram as soon as they could possibly do that. And I didn't know how much time I had.
Known as the silent killer, a saddle pulmonary embolism was threatening the 52-year-old Marine's life. A massive blood clot blocking airflow in both pulmonary arteries. Dr. Karras says sitting for 20 hours on the plane home from Iraq was likely the first thread of danger.
I'd never seen a saddle embolus before because they usually come in and they're an autopsy diagnosis. And so I had one there, so I didn't know what would happen next.
Struggling for his life, Chris was rushed to an interventional radiology suite, one of 3 at Tri-City, each equipped with the best technology available. It was here that Dr. Justin Gooding inserted a catheter and began the delicate task of breaking up the massive clot by injecting clot-busting medication directly to the blockage.
We're lucky to be able to use the latest technology here, and that definitely makes it easier to perform a procedure like this. And the easier it is to perform a procedure like this, in general, the better outcomes you're likely to have.
Chris's wife, Asha, didn't know what to expect when she flew to her husband's bedside from their home in Atlanta.
When I saw him in the hospital, I didn't know if I was going to be saying goodbye or helping him recover.
What she found was someone she calls a gift, ICU nurse Angie Perez.
We don't call her Angie, we refer to her as Angel because she truly is an angel. She took such good care of him.
The way she did it in such a caring and concerned manner just made me realize she was a very special individual, not just as a nurse, but just as a person.
He's gone over to Iraq to fight for our country, and what an honor it is for me to be able to take care of him and try to help him survive.
A medical team, experienced and highly skilled, state-of-the-art technology, and compassionate care, working together like interwoven threads. And 6 days later, Chris walks out of the hospital, but not for good. Humbled by the coordinated care he received from the entire team of medical professionals at Tri-City, Chris presented his group of lifesavers with challenge medals, just like the ones heroes earn for their exceptional performance in the field.
If a hero is someone that's dedicated to their job and to their profession and willing to give their all to help someone else, then I would count everyone at Tri-City as a hero.
That challenge coin sits on my dresser, so it's a constant reminder every day when I see it.
Remarkable. I just felt like hugging him because I didn't expect him to be in that good a shape. It was so good to see him alive. I get a little emotional. Sometimes I get tears in my eyes, and I did at that time.
These folks are truly dedicated to their mission and are, as far as I'm concerned, the best around at doing it.
I truly believe that if they'd taken him anywhere else, I might not have my husband here today.
Going to remember them for the rest of my life.